It takes two to tango, right?
Right.
Then maybe it's time to turn to the combo, HBO and Cinemax. The perfect cable match to light a February fire. With big-name entertainers, big screen excitement, the classics, the comics, plus one-of-a-kind events you'll only find on HBO and Cinemax.
You're looking good.
So call your cable company and strike the match, the HBO Cinemax combo. Hurry, because February's a short month, right?
Right.
Newsmaker Saturday. Bringing you face-to-face with the issues and the people who make the news. The Newsmakers. From the CNN News Bureau in Washington, Newsmaker Saturday.
President Reagan, at age 76, seems to just shrug off his illnesses. He also has no particular financial worries. Others are not so fortunate.
I will be sending to Congress a plan for providing, through Medicare, protection against the tremendous costs of catastrophic illness. Now, for those of you who might not have heard that term, that is those peculiar things that can happen either by way of an accident or an ailment, a disease, that results in hundreds of thousands of dollars in medical expense.
The protection would be made available to the nation's 30 million Medicare clients. A voluntary $4.92 a month premium increase would put a $2,000 a year cap on hospital and doctor costs. But the catastrophic illness plan would not cover everything. Nursing home care is not and would not be included in the Medicare expansion. The plan proposes individual medical accounts, something like IRA retirement plans, to provide for long-term care. For people under 65 who are not covered by Medicare and who are often not covered by any health care, the Reagan administration recommends that the states and the private sector fill the gap. The overall plan is considered a triumph for Health and Human Services Secretary Otis Bowen over Reagan cabinet conservatives who object to government taking on any more social service responsibilities. The president calls it all a giant step forward. But Congress's champion of the elderly, Florida Democrat Claude Pepper, does not think so.
Oh, but this is not the step of a giant, it's the step of a pygmy.
Welcome to Newsmaker Saturday. In Washington, I'm Charles Bierbauer. Our guest is the Secretary of Health and Human Services, Dr. Otis Bowen. And we're joined by Joe Davidson, who is the correspondent covering HHS and education for the Wall Street Journal. Dr. Bowen, this is not a simple subject, the catastrophic health proposal that the president is now preparing to send to Capitol Hill. I think it's important that we judge what it does do and what it doesn't do. You are expanding Medicare. What about the things that are not covered?
Well, our plan does call for the expansion of Medicare for the acute care catastrophic costs for the things that Medicare presently covers. And that does put an upper limit of $2,000 on out-of-pocket expenses. The plan, as put forth on Thursday, does not immediately cover the long-term care, nor does it immediately cover the catastrophic expenses of the under age 65 group. Certainly, there are reasons why it cannot immediately do it. I think because some of the suggestions that we had have to have a Treasury study to determine what the impact would be on the income and outgo to the federal government.
So those elements, the long-term care, the under 65, are still in sort of the recommendation and study and proposal stage. The immediate effect would be the enhancement of the Medicare coverage.
Yes, but I think that it is high time to get the study on these others going. Actually, my own opinion is that there is hardly enough money in the government or in the country to cover all of the catastrophic expenses of long-term care. When you have $500,000 a year going into Medicaid, and the results there when they need long-term care is nursing home care at an average of about $22,000 a person. That amounts to a tremendous amount of funding. But I think that we need to, first of all, educate the people as to what Medicare covers and what it doesn't cover. And so many of them do think that it covers long-term care when it actually doesn't. And then follow that with programs to stimulate the individuals to assume responsibility over the long term for their own care. Now, obviously, that is a little time away, but you have to start sometime, and I think the time to start is now.
Dr. Bowen, aren't the results of the Treasury Department study on using tax incentives for long-term care really almost in by now, in a sense? I mean, I've been told that Treasury Department officials have told officials in your department that they simply are not in favor of messing with the tax code because it was just recently revised.
Well, that is understandable, and that's a true statement. I can't say that they are, that they immediately think that we ought to have tax incentives for the development of programs by the insurance companies or for the purchase of policies by individuals. But they are expressing a willingness to study the impact, and that's what the program, as announced on Thursday, says to do.
So often in government, when things are studied, that's just another way of killing them. In the legislature, they say, well, let's table it.
Well,
in the administration, let's study it.
Let me give you the example of a year ago. In February, the President charged me and my department to study this issue and come up with ways where the private and the public sector could work together to find some solutions for the catastrophic expenses of illnesses. And I think that the study has resulted in two things. One, elevating the discussion and the debate so that something, I believe, will come out of it. And second, the acceptance by the administration of the report. Now, it is true that there is no immediate effect on the long-term care, but I don't think that that means that it is 30 or 40 years off in the future either. I think that something will be coming from it simply by what we can urge the states to help do. For example, the states can require catastrophic coverage be offered in all of their health care plans. They can also come up with some innovative things such as having a catastrophic portion of the accident insurance for automobile registration. You could have a high deductible there and still keep the rate very, very low, because a great deal of the catastrophic expenses for these people are due to accidents.
So you're looking for some creativity on the part of the states and a part of the private sector to fill in some of the gaps.
Oh, yes, very much. And I think that the same thing might be done. And again, these are just suggestions for athletic insurance, for example, have a catastrophic phase to it. And risk pools for those who are medically uninsurable. There's over 1.5 million people of the under age 65 who are medically uninsurable, and there's where a lot of the unpaid medical bills come from, and uncompensated care, as they call it. And if you could get that hooked into it, you could reduce the uncompensated care by a few $1 billion. I think the hospitals state that they are stuck with about $6 billion worth of bills every year as a result of uncompensated care.
We need to take a break here, Dr. Bowen. We've got some more things to talk about. I want to talk about some of the objections that we're going to hear from Capitol Hill and have heard already. Please stay with us. We'll be right back on Newsmaker Saturday.
Claude Akins here for Super Polygrip. Hey, if you wear dentures, I'll bet you know the pain of getting food stuck between your dentures and gums. Like these darn seeds. Ouch! Let me tell you about Super Polygrip. Watch. You see how it forms this seal between your dentures and gums? That's why Super Polygrip helps keep food out, dentures in. Simple. If you like to eat like I do. Remember, Super Polygrip keeps food out, dentures in.
This is my mom. And if everything I say about the four-wheel drive Isuzu Trooper 2 isn't true, may she be struck by lightning. It can carry a symphony orchestra or every book in the Library of Congress. And the nice part is the Trooper 2 starts at just $10.80. You have my mom's word on it. Mom?
See the affordable four-wheel drive Trooper 2 at your Isuzu dealer today.
So, you've got the wife's family in from out of town? Get the room you need from Thrifty Car Rental. Well, the big wedding day has finally arrived. Go in style with Thrifty. Going to be without your reliable old car for a while? Try a sporty substitute from Thrifty. When you need a car for a special occasion, see your phone book for the Thrifty location nearest you.
This young man is about to repair his own car. As you watch, he's actually fixing one of the biggest problems facing today's engines, clogged fuel injectors. He's fixing it with Mobil Super Unleaded Gasoline. Its advanced detergent formula can unclog fuel injectors and give your car a new injection of power. Drive your engine clean with Mobil Super Unleaded. High octane with a plus.
On Newsmaker Saturday, our guest is the Secretary of Health and Human Services, Dr. Otis Bowen. Dr. Bowen, in response to the proposal for a catastrophic health coverage plan, we heard Congressman Claude Pepper, the venerable 86-year-old Democrat from Florida, say it's not a giant step, but a pygmy step. Now, he thinks it ought to go a lot farther. Can you respond to that?
Well, certainly it is a small step, but I think it's a significant step, and I think it may be about as far as the country is able to go this particular session. And I don't mean by that that I favor a huge expansion of any program at all, but I do favor the stimulation of the private sector to come up with types of plans that would be acceptable to the people so that they will purchase insurance programs for the long-term care.
Dr. Bowen, isn't it fair to say that after a year of study on your part, after 6 years of the Reagan administration, there is still no administration policy toward long-term care other than to study it?
Well, I think that our study has, again, brought it to the forefront more, and I think that there will be, in the near future, steps towards solving that problem. But again, the field is wide open for long-term care insurance. In nursing homes, we spend about $32 billion a year, and about half of that, $16 billion, is paid for by Medicaid itself. And about 48.5% is paid for out of the individual's pocket, and then only about 1.5% is paid for by insurance. Now, the market is there, but they have to be able to develop a policy that is saleable.
In terms of the number of people affected, the amount of money spent, isn't long-term care really a much bigger problem than acute catastrophic illness?
Yes, and I've tried to emphasize that all along, that is the big problem. But because the expansion of or restructuring of Medicare to add $4.92 to the premium is being considered as an expansion of Medicare, and because I think it is probably the most easily and quickly doable, that has drawn the attention away from the other parts of our program. We have in the long-term care suggestions, an individual medical account coupled with insurance, which I think is a very innovative type plan. And you wouldn't have to wait 30, 40 years for it to take effect. It could take effect reasonably soon if we had the machinery put in place.
Well, the individual medical account is a little bit like the individual retirement account. I don't want to oversimplify that, but it would be something that you contribute to and draw from as you need it in later life. But that does get back to what Joe was suggesting in the first section, is the tax problem.
That's right.
Is the Reagan administration fully behind the IMA?
No, I can't say that they're fully behind it, but they're behind it enough to say that it needs to be studied to see what the impact would be. And I think that were there any other solution without altering the tax situation, that it would be grabbed onto quickly. But I have to say, and I think many people say, if not that, then what?
Well, some, you know, IRAs, individual retirement accounts, haven't sold really as well as some people expected. So even if Treasury says, okay, let's do the individual medical accounts, why should we expect many people to go out and buy those when they could only use that money for a specific reason when they aren't buying IRAs and they can use IRA money for any reason?
I think education of accepting responsibility for their own future and avoiding the fear of losing everything, all of their life savings all at once. I think there is, the people just aren't aware of that, and it is going to take a good educational process to get it done. If I'd like to, after the program, even draw you a picture of what I mean by the combination of individual medical account and insurance program combined, because I think it can work very well.
Well, you've only got 23 months left. Is that enough time to, one, study it, two, convince the administration that it's the worthwhile way to go, and three, educate people to take advantage of it?
It's a short period of time, but I don't think the idea will disappear simply because this is an issue that has been smoldering for so long and it's reached its peak, and I don't think that the people are going to let the issue disappear. But I am totally in favor of trying to keep it as much as we can into the private sector and keep it out of the hands of government as much as we can. But the 492 expansion part, I think is one that can be handled actually better by government because the machinery is already there, and also because we are not asking for any tax revenues at all. It is a pay-as-you-go plan, and it is a budget-neutral plan.
Just before you were appointed or nominated, you wrote an article in the Federation of American Health Systems magazine outlining a plan very similar to the one that is now the president's plan, except as I recall, that plan called for a $15, I believe, increase in the monthly premium. Why can you now have a plan for $492? In other words, what's the difference?
Well, the big difference is that we had hooked the increase in the premium of about, I think, $13 or $14 to the Part B only, and put I think it was a $750 upper limit on expenditures. And of course, by putting the upper limit on at 2,000 level and spreading it across 30 million people, you can reduce the premium way down.
Now, just to be clear for those who are not familiar, this is the premium for the Medicare, and the Part B you refer to as Medicare premiums are Parts A and Part B. They're two segments.
Part A deals with hospital only. Part B deals with the physicians, but the Part A, as I recall, is deducted from I'm sorry, it has been paid for through payroll deductions, and there's no cost to those above the age of 65 who qualify. But the Part B, one has to subscribe for it, and they pay a premium now, in 1987, I believe, of $17.90 a month. And our premium of $492 would be added on to the Part B premium, but it would also apply to the Part A expenses.
To both segments.
Yes.
We need to take another break. We've got more questions. Please stay with us. We'll be right back.
She's the mystery.
I don't care where you come from. Alaska will get you.
Alaska is the story that my father told of swift rivers running with salmon and gold. Alaska is so many things I have never known. Alaska is the warming sun calling me home. Alaska.
Moo. Behold the Isuzu Pup, the lowest price truck in America. About $6. Buy a pup now and you can get 3.9% financing or 500 pounds of bananas. Why, I saved enough money to buy this island and all the fish. Tenumeli, Kiki Bobo.
Hurry, 3.9% financing or $500 rebate offer ends soon.
Hi, I'm Tony Randall, and this February, Superstation WTBS and the Better World Society present Beyond Fear. a series of 5 programs dealing with U.S.-Soviet relations. On February 16th, learn what the Soviets really think of America in Behind the Threat. On the 18th, take a hard look at 40 years of the Cold War in Are We Winning, Mommy? And on February 19th, the U.S. and the Soviets unite to accomplish a common goal, to save an endangered species in 1,000 cranes. Go beyond fear with the Better World Society and Superstation WTBS.
Behind the Threat, Monday, February 16th. Are We Winning, Mommy? Wednesday, February 18th. 1,000 Cranes, Thursday, February 19th. 11:05 p.m. Eastern on Superstation WTBS.
On Newsmaker Saturday in Washington, I'm Charles Bierbauer. Our guest discussing the proposals for catastrophic health insurance or on our way to Capitol Hill is Secretary of Health and Human Services, Dr. Otis Bowen, and we're joined by the Wall Street Journal's Joe Davidson. Joe?
Dr. Bowen, one of the things being studied in the President's plan is a proposal that would replace Medicare, I believe, with some health savings accounts. Is it the administration's intention to eventually replace Medicare?
It is not my thought that that is their intention, at least immediately. That is another item that the President has asked to be studied. And that was not a part of the report that we had put out. It was a portion of the Domestic Policy Council's working group, and it's a good suggestion for it to be studied because it would put the whole Medicare system into the private care area. But one of the problems would be the transition period, because you'd have a lot of this of your age essentially, seems to me, be under double jeopardy here. You'd be paying for an IMA type account, plus you'd be still paying or having part of your wages deducted for the program. And then it would also take 30 or 40 years, it seems to me, to get it transferred totally.
On the issue of long-term care and the premium increase, if long-term care had been included in your proposal, and you wanted to finance it through a premium increase, how much would that $492 increase have been? Would it have been $20 increase? Or
I can't answer it, but it would have been an unaffordable thing for too many people. The premium would have to be very high. I can tell you the costs of the premiums that are being issued now for long-term care insurance range, I believe, from a couple $100 to close to $2,000 for somebody at the age of 65, and something like $400 or $500 up to $3,500 for somebody at the age of 75. So you can get some idea as to what you'd have to increase the premium by to cover long-term care.
Let me come back to the suggestion you made that this is budget neutral, because in this town everybody's concerned about budgets and deficits. It is budget neutral, and I think that's a fair assertion as it sits. But when it comes out of Congress, is it going to still be budget neutral, and how do you maintain that for the long run?
Well, the plan as being submitted is budget neutral, and obviously no one can be sure of what Congress may or may not do to the program, but certainly if they go beyond the program very much at all, it would be, I would think, subject to some very serious considerations of veto. But again, that has to be, we have to wait and see on that.
But the $4.92 increase in the premium is also going to be indexed to inflation, as would the cap, right?
We would index the $4.92 and the $2,000 to the medical inflation rate. Now, the medical inflation rate has been a little higher than the general inflation rate, so to keep it budget neutral, it would have to be indexed to that. And in addition to other means of being assured that the costs would be kept down, would be the programs that are already in place, such as the Graham-Rudman haulings, for example, would be one means of keeping the cost under control. The peer review organizations that we have in place review the appropriateness of admissions, the appropriateness of care, and the appropriateness of discharges to make sure that the costs are held down. And the capitation programs that we have going on now, the HMOs and so forth, will help to keep the costs down.
Are you concerned that Congress may add so much to your proposal, long-term care perhaps, that the President will find a need to veto it?
Well, that's always a danger, and I would caution Congress to study every little bit that they try to add on so that we end up with something that is very sensible and something that is affordable and something that will be acceptable to the administration.
We've got only a few seconds, but you're a relative newcomer to Washington politics. How did you outflank the cabinet conservatives who didn't want to go even this far?
Well, I have no answer for that, and I wasn't trying to outflank anybody. I just thought that our program was one that whose time had come, and if I believe in something, I'm going to work for it.
Dr. Bowen, thank you very much. Dr. Otis Bowen, Secretary of Health and Human Services, our guest on Newsmaker Saturday. For Joe Davidson, I'm Charles Bierbauer. Thanks for joining us.
If you'd like to comment on this weekend's program, write to Newsmaker Saturday, Cable News Network, 111 Massachusetts Avenue, Northwest, Washington, D.C., 20001.